Pain around the ear, especially in front of the ear or below the ear, is a very common symptom that you come across these days. One of the major reasons for that is unilateral chewing practices people have adopted. There are times when the styloid process, a little thin bone which comes from the skull base downwards towards the lower portion of your jaw, is something that can get elongated, as a result of which you can get tenderness, pain below the ear. The other problem that causes this is excessive use of mobile phones on the ear. Namaskara. My name is Dr. Harihara Murthy. I am practicing in Bangalore as an ENT specialist for more than 3 decades. Pain around the ear, especially in front of the ear or below the ear, is a very common symptom that you come across these days. One of the major reasons for that is unilateral chewing practices people have adopted. When you chew on one side, what happens is you are putting excessive pressure only on one side of the jaw. Assuming you're chewing food on the left side only, not using the right side at all or sparingly, what happens is you're putting a lot of food between the jaws and chewing on this side. This side has nothing in it. So what happens? There's an unequal activity. As a result, this joint is going to impinge on the surface where it joins the joint. And as a result, this unequal pressure, the excessive pressure on the opposite side, can give rise to a small injury to the disc, the interarticular disc, which can get swollen, as a result of which there's pressure and you can get pain, which may be reflected as pain in the ear, in front of the ear, or below the ear sometimes. Having said that, there are times when the styloid process, a little thin bone which comes from the skull base downwards towards the lower portion of your jaw, is something that can get elongated, as a result of which you can get tenderness, pain below the ear. The other problem that causes this is excessive use of mobile phones on the ear. Most people don't even know that the ear is to be protected from extraneous things like this. When you use your mobile, you need to keep the mobile at least a centimeter away from the ear. That is what the book instructions say. When you open your mobile, normally you unbox it, but never look into the instruction manual. In the instruction manual, it's written that the standard radiations are collected at 1 centimeter away from the skin. Most of us use the mobile on the ear because Indians are loud people. We don't talk softly. We speak very loud, even in public places, as a result of which to have a conversation on the mobile may be difficult if you keep it 1 centimeter away. So people tend to use it plastered on the ear, and that is an absolute no-no. So people who stick the mobile inside the helmet to talk when they are driving are at very high risk of radiation, causing them pain, sometimes worse issues. So keeping the mobile 1 centimeter away from the skin while speaking or using the speakerphone may obviate that particular problem. Chewing on both sides as a routine is a good practice. Using a hot fermentation, if the pain does start, doing a hot fermentation in front of the ear, below the ear, helps as well. These are small things one can do, but then consciously eating is something that one has to practice. Normally we are in the habit of talking when we are eating, seeing a movie when we are eating in the house, or looking at the mobile and eating, or working on the job and eating. So these are practices which give rise to unconsciously chewing on one side sometimes. Hurriedly eating. These are things that one should avoid, and being conscious about what you're doing when you're chewing is very good to follow.